Sarah Martinez had only been working as a trauma nurse for 3 weeks when the emergency call came through the hospital's communication system. The voice was urgent and crisp, cutting through the usual evening calm of Memorial Hospital's emergency department. Multiple gunshot victim incoming, critical condition, ETA, 4 minutes. Her hands trembled slightly as she pulled on fresh gloves, the familiar rush of adrenaline mixing with the uncertainty that still plagued her as a new graduate. Around her, the experienced medical team moved with practiced efficiency, preparing Trauma Bay 3 for what sounded like a severe case. Dr. Williams, the attending physician, barked orders while nurses wheeled in additional equipment and blood products from the hospital's reserves. The ambulance sirens grew louder, their wailing echoing off the hospital walls as the vehicle approached the emergency entrance. Sarah positioned herself near the trauma bed, checking and rechecking the monitors and IV lines that would soon become lifelines for whoever was coming through those doors. She had studied scenarios like this countless times in nursing school, but the reality of her first major trauma case felt overwhelming. When the paramedics burst through the automatic doors, Sarah's breath caught in her throat. On the stretcher lay a man who appeared to be in his early 30s, his military-style clothing torn and blood-soaked. The lead paramedic rattled off vital signs and injuries as they transferred him to the trauma bed. 20 gunshot wounds, massive blood loss, blood pressure dropping rapidly, pulse weak and thready. The patient's eyes were closed, his face pale beneath dirt and sweat. Despite his unconscious state, something about his build and bearing suggested military training. His dog tags caught the harsh fluorescent lights as the medical team began cutting away his clothing to assess the full extent of his injuries. Sarah noticed the distinctive trident tattoo on his arm, the mark of a Navy SEAL, though she kept this observation to herself. Dr. Williams immediately began the primary survey, calling out findings as he worked. Gunshot wounds to the chest, abdomen, both arms, and legs. Several appeared to be through-and-through wounds, while others showed signs that bullets remained lodged in tissue. The patient had lost an enormous amount of blood, and his condition was deteriorating rapidly despite the paramedics' efforts during transport. Sarah found herself assigned as the primary nurse for the case, a responsibility that both terrified and energized her. She had specifically requested to work in trauma because she wanted to make a difference in critical situations, but she had never imagined her first major case would be this complex. The other nurses moved around her with experienced confidence, but she noticed they occasionally glanced her way with concern, aware that this was beyond what most new nurses handled in their first month. The trauma bay became a controlled chaos of medical professionals working to save a life. Blood transfusions were started immediately, with type O negative flowing through multiple IV lines as the lab rushed to complete cross-matching for more specific blood products. Sarah monitored the patient's vital signs, calling out changes while simultaneously preparing medications and assisting with procedures. As they worked, fragments of the patient's story emerged from the police officers who had accompanied the ambulance. The man had been involved in some kind of incident that had resulted in multiple attackers opening fire. The details were sketchy, but it was clear that this was not a random crime. The patient had been found by civilians who called for emergency assistance, though the scene had been secured by federal authorities shortly after. Dr. Williams made the decision to take the patient directly to surgery, but not before stabilizing him enough to survive the trip to the operating room. Sarah worked alongside the surgical team as they prepared for what would likely be a marathon operation to remove bullets, repair damaged organs, and address the massive trauma to multiple body systems. The patient's blood pressure continued to drop despite aggressive resuscitation efforts. In the elevator heading to the surgical floor, Sarah found herself studying the patient's face. Even unconscious and fighting for his life, there was something about his features that suggested strength and determination. She had read about Navy SEALs during her military appreciation studies in nursing school, understanding that these were elite warriors trained to survive in impossible situations. If anyone could pull through this level of trauma, it might be someone with that kind of training and mental fortitude. The surgery lasted 14 hours. Sarah remained involved throughout, rotating between the operating room and recovery as part of the critical care team. She witnessed surgical procedures she had only read about in textbooks, watching as surgeons worked meticulously to remove bullets and repair damage to vital organs. 3 bullets had come dangerously close to the patient's heart, while others had damaged his liver, spleen, and intestines. During brief breaks, Sarah researched everything she could about treating multiple gunshot wounds and the specific challenges faced by trauma patients with this level of injury. She studied protocols for massive transfusion, reviewed medication dosages, and prepared herself for the complex post-operative care that would be required. Her supervising nurse, Janet, noticed her dedication and began providing additional guidance and support. As dawn approached, the patient was finally stable enough to be moved to the intensive care unit. He remained unconscious, connected to multiple machines that monitored his heart rhythm, blood pressure, oxygen levels, and other vital functions. Sarah volunteered to take the assignment as his primary ICU nurse, despite her limited experience with such complex cases. Janet agreed to work closely with her, providing the mentorship needed to navigate the challenges ahead. The ICU became Sarah's second home as she monitored her patient around the clock. Every hour brought new challenges. As his body fought to recover from the massive trauma, his blood pressure remained unstable, requiring continuous medication adjustments. His breathing was supported by a ventilator while his lungs healed from injuries caused by bullets that had passed through his chest cavity. Sarah documented everything meticulously, tracking his progress and watching for signs of complications that could threaten his recovery. She learned to read the subtle changes in his vital signs that indicated improvement or deterioration. When his temperature spiked, suggesting possible infection, she immediately alerted the medical team and assisted with blood cultures and antibiotic administration. On the second day in the ICU, small signs of improvement began to appear. His blood pressure stabilized somewhat, requiring less medication support. Laboratory values showed his body was beginning to recover from the massive blood loss. Most encouraging, brain scans showed no signs of injury despite the trauma and blood loss he had experienced. Sarah began talking to her unconscious patient during her care activities, having read about the potential benefits of verbal stimulation for comatose patients. She told him about the weather, described the view from his ICU window, and shared encouraging updates about his medical progress. The other nurses smiled at her dedication, remembering their own early enthusiasm for patient care. By the third day, the patient began showing signs of neurological recovery. His pupils became more reactive to light, and he occasionally moved his limbs in response to stimuli. Sarah felt a growing sense of hope as she witnessed these small but significant improvements. She increased her verbal interactions with him, explaining procedures as she performed them and encouraging him to continue fighting. The breakthrough came on the fourth morning when Sarah arrived for her shift to find the patient's eyes open, though he remained intubated and unable to speak. His gaze tracked her movements around the room, and he appeared to be trying to communicate through eye movements and facial expressions. Sarah immediately called Dr. Williams, who began the assessment process to determine if the patient was ready for extubation. Throughout that day, the patient's alertness continued to improve. He followed simple commands like squeezing hands and moving fingers, indicating that his cognitive function was returning despite the severe trauma he had experienced. Sarah spent extra time explaining his condition and the progress he had made, seeing recognition and what appeared to be gratitude in his eyes. The medical team made the decision to remove the ventilator that evening, a milestone that marked a significant step in his recovery. Sarah remained at his bedside during the extubation process, ready to provide support and monitoring as he transitioned to breathing on his own. When he took his first independent breaths and whispered a barely audible, "Thank you," she felt tears of relief and joy threatening to overwhelm her professional composure. As her shift ended that night, Sarah reflected on the incredible journey of the past 4 days. She had been thrust into a situation far beyond her experience level, yet somehow she had risen to meet the challenge. Her patient was not only alive but showing remarkable signs of recovery from injuries that could easily have been fatal. She had no idea that the most surprising part of this story was yet to unfold. The next morning brought a development that Sarah had not anticipated. As she arrived for her shift and checked on her patient, she found him awake and alert, propped up slightly in his hospital bed. His voice was hoarse from the ventilator tube, but he was able to speak clearly and seemed remarkably coherent for someone who had been near death just days earlier. His name was Marcus Thompson, and as Sarah had suspected from his tattoo, he was indeed a Navy SEAL. What she learned during their first real conversation, however, went far beyond anything she could have imagined. Marcus had been working on a classified operation involving domestic terrorism when he had been ambushed by a group of individuals who had been under federal surveillance for months. The attack had not been random violence or even a typical criminal incident. Marcus had been deliberately targeted because his investigation had uncovered a network of individuals planning a series of coordinated attacks on military installations across the country. The 20 gunshot wounds he had sustained were the result of a carefully planned ambush designed to eliminate him before he could report his findings to federal authorities. As Marcus shared these details with Sarah, she began to understand why police and federal agents had been present at the hospital since his arrival. She had noticed men in suits stationed near the ICU entrance and had assumed they were providing security for a high-profile patient. Now she realized they were there because Marcus possessed information that could prevent a national security catastrophe. The recovery process proved to be as remarkable as the circumstances surrounding Marcus's injuries. His SEAL training had not only prepared him for the physical demands of surviving massive trauma, but had also given him the mental discipline to focus entirely on healing. He followed his medical regimen precisely, never complained about pain despite refusing strong narcotic medications that might cloud his thinking, and pushed himself through physical therapy with determination that amazed his care team. Sarah found herself becoming more than just his nurse. She became his primary advocate and supporter during the most challenging parts of his recovery. The extensive nature of his injuries meant that every day brought new challenges. Some of the gunshot wounds became infected despite preventive antibiotics, requiring additional surgical procedures to clean and irrigate the affected tissues. Other injuries developed complications as his body worked to heal from the massive trauma. During the long hours of his recovery, Marcus shared more details about his military service and the investigation that had nearly cost him his life. He had spent years in special operations, participating in missions around the world that he could only describe in general terms. His current assignment with a joint federal task force had been his first extended domestic operation, focusing on preventing terrorist activities on American soil. The terrorist network Marcus had been investigating was more sophisticated and dangerous than initially believed. They had military-grade weapons, detailed knowledge of security procedures at various installations, and what appeared to be inside information about federal law enforcement activities. The fact that they had been able to identify Marcus and organize an ambush suggested that their organization had capabilities that posed a serious threat to national security. Sarah learned that Marcus had been working undercover for months, building relationships with individuals connected to the terrorist network and gathering intelligence about their plans and capabilities. On the night he was shot, he had been meeting with a contact who was supposed to provide information about the timing and targets of planned attacks. Instead, he had walked into a trap that nearly killed him. The medical challenges of his recovery were compounded by the security concerns surrounding his case. Federal agents needed to debrief him about his investigation, but his doctors insisted that his medical stability had to be the priority. Sarah found herself coordinating between medical staff and federal personnel, ensuring that Marcus received the care he needed while also facilitating the intelligence gathering that could prevent terrorist attacks. As the days passed, Marcus's strength returned gradually, but steadily. The multiple surgical sites began to heal properly, and his body showed remarkable resilience in recovering from the massive blood loss and organ damage. His appetite returned, and he began participating more actively in his physical therapy sessions. Sarah documented every aspect of his progress, noting improvements that continued to exceed medical expectations. The relationship between Sarah and Marcus evolved from strictly professional to something deeper, as she witnessed his courage and determination during the most vulnerable period of his life. She admired his dedication to his mission even while recovering from life-threatening injuries, and he appreciated her skill and compassion during his darkest hours. Neither spoke openly about their growing feelings, both understanding that the circumstances made any personal relationship complicated. During his second week in the hospital, Marcus began working with federal investigators who visited his room regularly to gather intelligence about the terrorist network. Sarah often remained in the room during these sessions, partly for medical monitoring and partly because Marcus requested her presence. He seemed to find her calming influence helpful when discussing traumatic aspects of his undercover work. The information Marcus provided painted a disturbing picture of a well-organized group with plans to attack multiple military installations simultaneously. The attacks were designed to cause maximum casualties and to demonstrate that domestic terrorists could strike at the heart of American military power. The timing was planned to coincide with a national holiday when security might be reduced and the symbolic impact would be maximized. Federal authorities worked around the clock to verify Marcus's intelligence and to locate the members of the terrorist network. Several arrests were made based on information he provided, but key figures remained at large and continued to pose a threat. The hospital remained under heightened security as investigators worried that the terrorists might attempt to eliminate Marcus before he could provide additional testimony. Sarah's role in Marcus's care expanded beyond traditional nursing, as she became his primary point of contact with the outside world. She screened his visitors, coordinated his medical appointments, and provided emotional support during the challenging process of recovery and investigation. Her supervisors recognized her exceptional dedication and skill, noting how her care had contributed significantly to what was becoming a remarkable recovery. The physical therapy sessions revealed the full extent of Marcus's determination to recover completely from his injuries. Despite significant muscle and nerve damage from several of the gunshot wounds, he pushed himself through exercises designed to restore his strength and mobility. Sarah often assisted with these sessions, encouraging him when progress seemed slow and celebrating small victories along the way. As Marcus's condition continued to improve, discussions began about his eventual discharge from the hospital. However, the ongoing investigation and security concerns complicated what would normally be a straightforward transition to outpatient care. Federal authorities needed to ensure his continued safety, while also maintaining access to him for ongoing debriefing and potential testimony in court proceedings. The terrorist threat remained active and dangerous. Intelligence gathered from the arrests made based on Marcus's information suggested that the network was larger and more sophisticated than originally believed. Plans were underway to accelerate the timeline of planned attacks, possibly in response to the federal investigation that Marcus's survival had made possible. During his third week in the hospital, Marcus reached a level of physical recovery that would normally indicate readiness for discharge. His surgical wounds were healing well, his strength was returning, and he was able to walk independently for short distances. However, the complexity of his situation meant that his medical team, federal investigators, and security personnel had to coordinate carefully to ensure his continued safety and recovery. Sarah realized that Marcus's discharge would likely mean the end of her involvement in his case and possibly the end of their daily interactions. The thought filled her with an unexpected sense of loss, as she had become deeply invested in his recovery and genuinely cared about his well-being. She had never experienced such a strong connection with a patient, and the prospect of saying goodbye was more difficult than she had anticipated. The evening before his planned discharge, Marcus asked Sarah to sit with him for a few minutes after completing her nursing responsibilities. He wanted to thank her for everything she had done, and to let her know how much her care and support had meant to him during the most challenging period of his life. As they talked quietly in his room, both acknowledged the unique bond that had developed between them during his recovery. Neither of them anticipated that the next morning would bring a development that would change both of their lives in ways they could never have imagined. As Sarah prepared for what she thought would be her final shift caring for Marcus, she had no idea that federal investigators had made a discovery that would transform her from a nurse into a key figure in a national security investigation. Sarah arrived at the hospital the next morning, expecting to complete Marcus's discharge paperwork and say her final goodbyes. Instead, she found the ICU unit buzzing with activity and several new faces in dark suits stationed throughout the area. Agent Jennifer Collins of the FBI was waiting near the nurses' station, asking to speak with Sarah privately about her patient care activities over the past 3 weeks. The conversation that followed turned Sarah's understanding of the situation completely upside down. Agent Collins explained that federal investigators had been monitoring all communications and activities related to Marcus's case, including reviewing hospital security footage and interviewing staff members. During this process, they had discovered something that elevated Sarah from a caregiver to a person of significant interest in their investigation. The terrorist network that had attempted to kill Marcus had not given up after their initial failed attempt. Instead, they had been actively seeking opportunities to finish what they had started, including attempts to infiltrate the hospital where Marcus was recovering. Federal surveillance had identified several individuals who had tried to gain access to the ICU under false pretenses, posing as medical personnel, maintenance workers, and even family members. What made Sarah's situation particularly significant was that she had unknowingly thwarted at least 2 of these infiltration attempts through her careful attention to security protocols and her protective vigilance over Marcus's care. Security footage showed her questioning individuals who claimed to have authorization to enter Marcus's room, verifying credentials that turned out to be falsified, and reporting suspicious activities that led to the identification and arrest of potential assassins. Agent Collins revealed that one particularly dangerous attempt had occurred during Sarah's night shift, just 4 days earlier. A man claiming to be a respiratory therapist had attempted to enter Marcus's room with equipment that contained a concealed weapon. Sarah had insisted on verifying his identity through proper hospital channels before allowing access, a delay that gave security time to discover that no respiratory therapy had been ordered and that the individual was carrying falsified hospital identification. The FBI had been tracking the terrorist network's activities through multiple channels, but Sarah's inadvertent interference with their assassination attempts had provided crucial intelligence about their methods and capabilities. Her detailed nursing documentation had also captured information about visitors and activities that proved valuable in mapping the network's structure and identifying previously unknown members. Federal investigators now needed Sarah's cooperation in several ways. First, they wanted her to provide detailed testimony about everything she had observed during Marcus's hospitalization, including descriptions of individuals who had attempted to gain access to his room and any unusual activities she had noticed. Second, they needed her to continue working with Marcus as part of a carefully planned security operation designed to capture remaining members of the terrorist network. The plan was both simple and dangerous. Marcus would be discharged from the hospital, but would continue to require regular medical follow-up care for his injuries. Rather than transferring his care to another facility or provider, federal authorities wanted Sarah to continue as his primary nurse in an outpatient capacity. This would provide cover for continued surveillance while maintaining the medical care that Marcus legitimately needed. Sarah's role would extend far beyond traditional nursing responsibilities. She would be working directly with federal agents to monitor for any signs that the terrorist network was continuing their attempts to target Marcus. Her medical visits would be carefully coordinated with law enforcement surveillance, and she would receive specialized training in recognizing and responding to potential security threats. The arrangement would require Sarah to take a leave of absence from her regular hospital position and work directly with federal authorities under a special contract that provided both compensation and legal protection. She would essentially become part of Marcus's security detail while maintaining her primary responsibility for his medical care and recovery. Agent Collins was honest about the risks involved in the proposed arrangement. The terrorist network had demonstrated both the capability and willingness to use lethal force, and anyone associated with Marcus's protection would become a potential target. Sarah would receive security training and would have access to federal protection, but there were no guarantees that the assignment could be completed without danger to all involved. The decision was not one that Sarah could make lightly. She was being asked to leave her normal life and career path to become involved in a federal investigation that could last months or even years. The work would be dangerous, stressful, and would require her to maintain multiple levels of deception while carrying out her nursing responsibilities. However, Sarah also understood that her unique position and relationship with Marcus made her particularly valuable to the investigation. She had already proven capable of providing exceptional care under difficult circumstances, and her natural vigilance and attention to detail had already contributed significantly to protecting Marcus's life. Federal authorities believed that she was the ideal person to continue in this expanded role. Marcus was consulted about the proposed arrangement and strongly supported Sarah's involvement in his continued care and protection. He trusted her completely and believed that her presence would actually enhance his security while providing the medical oversight he needed during his ongoing recovery. He also admitted that the prospect of continuing to work with Sarah was personally appealing, as their relationship had become important to him during his hospitalization. After careful consideration and consultation with her family and supervisors, Sarah agreed to participate in the federal operation. She understood that she was making a commitment that would fundamentally change her life and career trajectory, but she also believed that she had a responsibility to help protect national security and to continue caring for a patient who had become much more than just a professional obligation. The transition from hospital nurse to federal operative happened quickly but thoroughly. Sarah received intensive training in personal security, surveillance detection, and emergency communication procedures. She learned to recognize potential threats and to respond appropriately to dangerous situations, while maintaining her cover as a medical professional, providing routine care. The outpatient care arrangement was established in a secure facility that appeared to be a normal medical clinic, but was actually a carefully designed surveillance and protection operation. Sarah's medical visits with Marcus were real and necessary, as his recovery continued to require professional monitoring and care. However, each appointment was also an opportunity to gather intelligence and to monitor for terrorist activity. The operation proved successful beyond federal expectations. Over the course of several months, Sarah's continued care of Marcus provided the cover needed for law enforcement to identify and arrest the remaining members of the terrorist network. Her medical appointments became the basis for surveillance operations that ultimately prevented the planned attacks on military installations and dismantled a significant domestic terrorism threat. Throughout this period, the professional relationship between Sarah and Marcus evolved into something deeper and more personal. The shared danger and unique circumstances of their situation created a bond that grew stronger as they worked together to support the federal investigation, while ensuring Marcus's complete recovery from his injuries. The terrorist network was ultimately neutralized through a combination of arrests, prosecutions, and intelligence operations that prevented multiple planned attacks. Marcus's survival and testimony were crucial to this success, but Sarah's role in protecting him and supporting the investigation proved equally important to the positive outcome. When the federal operation was finally completed, Sarah faced another major life decision. She could return to traditional hospital nursing, having gained valuable experience and recognition for her exceptional service. Alternatively, she could pursue a career in federal law enforcement or security, building on the skills and knowledge she had developed during the investigation. Sarah chose a third path that combined her passion for nursing with her newly developed expertise in security and federal operations. She accepted a position with a specialized federal medical unit that provides care for personnel involved in sensitive government operations. Her work now involves caring for individuals whose medical needs are complicated by security considerations, much like her original assignment with Marcus. Marcus completed his recovery and returned to active duty with the Navy SEALs, though his assignment was modified to account for his experience with domestic terrorism investigations. His relationship with Sarah continued to develop even after the federal operation concluded, and they eventually married in a small ceremony attended by many of the federal agents and medical personnel who had worked on the case. The experience transformed both of their lives in ways they never could have anticipated when Sarah first responded to that emergency call 3 weeks into her nursing career. What began as a routine trauma case evolved into a national security operation that prevented terrorist attacks and led to a lifetime partnership between two people who had found each other in the most unlikely circumstances. Sarah's exceptional nursing care during those critical first days had not only saved Marcus's life, but had also positioned her to play a crucial role in protecting national security. Her attention to detail, dedication to her patient, and natural vigilance had contributed to outcomes that extended far beyond the hospital walls where their story began. Years later, Sarah often reflects on how a single emergency call changed the entire trajectory of her life and career. Her decision to volunteer as Marcus's primary nurse had been motivated by professional dedication and a desire to help someone in crisis. She never imagined that this choice would lead her into the world of federal investigations, national security operations, and ultimately to finding the love of her life in the most unexpected circumstances.